Now, we already talked about what causes migraine and how we can avoid those triggers. The other thing I like you to practice in order to avoid taking medication for years, because what happens to people who have migraine, they will take two kinds of migraine medication. One is preventative, so they would take that for years, try to prevent the migraine. The second one is usually as needed when the migraine started coming, and then they will take that. And for this emergency medication, it would be better to take that early stage when you feel like your migraine is going to come, started that, and that will avoid, you can help you to avoid taking too much when the migraine really comes. But taking those two medications for more than 5-10 years, eventually, you lose the medication lose the strength. Not only that, but you have to add more medication, increase the dosage, and that can profoundly change the chemicals in your brain. And there is a long-term side effect if you search any kind of medication, if you need to take that forever. So in order to reduce the dosage or eventually get rid of those medications, and we need to do something like acupuncture once or twice a week, but then you can also do the acupressure. That will have preventative effect. While doing that before you go to sleep, combining meditation, this acupressure actually rebalance your nervous system and relax the muscles around the eyes and the neck. So you get more than two benefits. One, you can relax the muscles around the eyes and neck, so you can actually bring more blood flow to your eyes and neck, so that you can improve your vision when you get older or even in a younger age. Second, you, by relaxing all of those muscles, reduce the frequency of migraine. And third, combining acupressure and the meditation before you go to sleep or before you get up, you actually rebalance your nervous system. You can sleep deeper. You can start your morning activity in a very happy mood. So let me show you those points. One point is at the end of the eyebrow, and this called the urine bladder 2. And if you press that, you feel kind of tender. You control the strength, how much pressure you can apply. So when you're lying down before you go to sleep, press that for 30 seconds, and then relieve the pressure and press that again for another 30 seconds. And the other choice you can make is you press that for 30 seconds or for a minute, then switch to another point. Use the other finger, because you don't want to make the one finger work so hard, so you can injure your muscle tendon. So switch to another point, which one finger breath outside the outer corner of the eyes. So you line up your thumb at outer corner of the eyes, and you find this indentation and just press that, 1 minute, 30 seconds, and then you switch to another spot, which is very important. It's called a gallbladder 20, and that relaxes your neck muscle, bring the blood flow and energy flow to your eyes, retina. So it's not only good for migraine, but also can benefit your eyesight. So behind the ear, there is a bone called mastoid, and below and a little bit behind there is an indentation, and that point you can press to relieve the muscle tension. Of course, you're going to do that when you're lying down, not sitting up. So either before you go to sleep or before you get up. And that's the third point. And the fourth point you can do, especially for people with migraine with the vision problem. So when the migraine comes, not only the stabbing headache, but also they have vision change. It was kind of scary because the blood vessel providing the blood flow to your eyes kind of constricting. You can lose your vision temporarily, or you have some wiggling line or flashing light. So for those kind of migraine, like you can do this point just below your pupil and just right on your orbital bone, and press that for 30 seconds or 1 minute. So you got bladder 2, you got extra point Taiyang, you got stomach 3, and you got gallbladder 20 just behind your ear, just inferior and posterior to the mastoid bone. So you can alternate those 4 points and use different fingers, so don't overuse one finger causing the joint pain. That will help.